Hello, my name is Judith Frye, and I want to first thank you for taking a few moments today to share my cancer journey with me. In September of 2018, I was diagnosed with stage 4 metastatic breast cancer. Dr. Barvey and I had multiple discussions about my options for my treatment going forward, and we decided on a targeted therapy. After 23 months, scans were ordered as they were every 3 months, and they reflected that the targeted therapy drug that I was currently on was no longer adding any value. In other words, it was not shrinking my tumors any further or staving off the progression of my cancer. And along with Dr. Barvey, again, she offered me two options: one, standard of treatment, and the second, a clinical trial at Mary Crowley Cancer Research Center. So because of my studies and my research, I felt very comfortable with the clinical trial option, and that's what I elected to do going forward. Unfortunately, this particular trial, after the 6th session, caused my body to have a severe allergic reaction. And after my second discussion with Dr. Barvey about my options, one, standard of treatment, and the second, another clinical trial, I decided that it would be very easy to go ahead and do another second clinical trial. This second clinical trial was, one, an easy decision, and two, has produced amazing results. I take a small pill, 5 milligrams once a day. It's a targeted therapy, and once a month I visit the clinic for labs. My last scans reflected my tumors have all shrunk by greater than 83%. Some are not even visible any longer, and my tumor marker tests, which are done monthly and then quarterly, all reflect normal cancer tumor markers. So I'm very excited about this clinical trial and very excited to share my experience with you, because without the clinical trials that are run at Mary Crowley Cancer Center, we as cancer patients would have no other options other than standard of treatment. When I initially became a patient of Mary Crowley Cancer Center, one word I would use to describe my experience was hope. From the moment you enter the door, the receptionist, the intake nurse, the oncology nurses, your clinical trial nurse, and your oncologist always make you feel hopeful. They treat you with compassion and care. Thank you again for listening to my cancer journey, and I would like to just take a moment to tell you how important your donations now and in the future will be to patients like myself. Without your support, clinical trials would not be an option for those of us who no longer can be helped through standards of treatment.